Hello and welcome back to LTC Heroes Live by Experience Care. My name is Peter Murphy Lewis. I am the co-host along with Victoria Rama. Today we are joined on the program with Mike Burr. He's the Chief Technology Officer at Social Mobile, and we're excited to talk to him. Mike, you are not our average guest because normally Victoria and I understand what we're talking about when we interview, but I have a feeling the Chief Technology Officer can talk right over my head. So with that introduction, Mike, welcome to the program.
Hey, thanks for having me. I am very excited to be a part of the show today. I think we're doing a lot of good things in healthcare from a Social Mobile's perspective with products and services that really sort of propel healthcare for patients, so as well as healthcare providers.
So Mike, from a very simple level, for someone in long-term care, what is Social Mobile? If I go to your website, I can tell you your technology, but from a long-term care person, if I'm a director of nursing, I'm an administrator, if I own 15 facilities, can you explain what Social Mobile does?
Yeah, absolutely. So we are a partner of Google's, specifically the Android Enterprise team. And so we build products and services and solutions that are verified by Google for particular verticals, one of those being healthcare. And so the benefit to that is things like, devices that nurses will carry, or large screens that have integrated touch panels for patient care. Also wearables that track the movements of, folks in like long-term living facilities, things of that nature. So there's a lot of things that we do there, and they're all built on the platform of Android, specifically Google certified versions of Android or Google mobile services. That really lends to the security of the platform because we're getting all the best of the updates and the requirements to meet those standards by Google. So this is not some forked version of Android like an Amazon tablet, for example. This is legitimate, real certified Google operating systems on these devices for many use cases, particularly in this area for healthcare.
In terms of your background, tell me a little bit how you got to Social Mobile and why you're passionate about what you guys are doing. I appreciate you breaking down the technology. It's not every single person who wants to do what you're doing. So tell me about your personal passion and how it lines up with your professional.
Yeah, so I've been in IT, or I should say technology, for quite a long time. Long time ago, past life, I was in the Army, U.S. military. So that led me into an electronics background. And then long story short, I've been in mobility. So that would be, phones, tablets for about 15 years, right when things started coming out, like the first iPhone, the first Android phones. And from there, I worked my way through McAfee. I worked at Intel for a while. And then I worked for a couple small startups because I saw mobility really, taking a hold of how people work. It's been, last like 5 to 8 years, we've transformed into this mobile first world. You don't see nurses, typically, it still happens, but you don't see them walking around with big laptops anymore. Sometimes the carts, but for patient care, it's mobile first now. And so I spent the last 8 years at Google on the Android team. I was the global security expert for the Android Enterprise team. So I was well integrated into the Android operating system. Social Mobile was a partner of Google and the Android Enterprise team. I'd known that team for quite some time, helped train some of the experts that are actually on staff. And then one thing led to another. I saw the really good stuff that they were doing, particularly in healthcare, and building devices and specialized pieces of gear and software solutions that worked as an integrated platform, so that healthcare facilities, even end users, like even the patients, had a very easy experience to get their job done as far as the healthcare providers, or if the users, one particular integrated solution, and which I'll cover as we move forward. But really what drew me to Social Mobile was, number one, they were already a Google partner. They build good quality equipment. And I already knew that because of them being a partner. As a security person, obviously having some of those security capabilities built directly into their hardware and their software solutions, that made me comfortable. And I, for personal reasons, not myself, but, I have family members that are in long-term care, and it was just important to me on a personal level. So everything lined up, and so it made sense for me to join Social Mobile to help propel the good stuff that they're building and sort of keep that moving along.
I've got a question that I'm gonna try to phrase it as if I were my mom.
Okay.
So my mom might say, what's an Android? And she would say, I have a Samsung. Is that the same? Or she might say, I used to have an iPhone. Is that the same? And she's gonna say, why does he only focus on one cell phone? How do you explain? And you mentioned it a little bit briefly at the beginning, but how do you explain why Android is your passion?
Well, okay, for a couple of reasons. First of all, Android is the operating system. So when you think of a computer, you think of Mac and the Mac operating system, you think of Windows, you might, if you're a techie, you might think of Linux, right? So in the mobile world, there's really only two operating systems. There's Android and then there's iOS. iOS is on all the Apple products, right? The iPhone, the iPad. Android is on everything else. So in the world of consumer and enterprise, there's over 3 billion Android devices deployed globally. And these are just the the Google certified Android devices. iOS doesn't even have that many, half that many globally. Now, the reason it's super important for business is about 8 years ago, Android was more of a consumer product. They decided to start add some very critical enterprise grade management capabilities. And now it's a very modern, well thought out, mature part of Android operating system, which is called Android Enterprise. And that is how you manage Android devices. The key difference on why Android is important in a lot of business world is because when you look at an iPhone or an iPad, that's all you get. It's a phone or a tablet. In many verticals, finance, healthcare, pharma, you need devices that meet specific needs. For example, tablets or customized devices that have the Android operating system on them can be made like what we make for very particular specific use cases. You get a very specific private label device that's Google certified that meets exactly the needs that you might have. Like one of the public use cases we have is for VaxCare. This is a vaccine management solution that's a tablet built into a stand that has a Honeywell scanner on the bottom. It's built on Android. It's certified by Google, and we actually were able to deliver that even during the COVID outbreak to help many practices deliver those vaccines. They were enabled with LTE. So we were able to put this together in a relatively short amount of time, build this for VaxCare, and they were able to deploy those in the field and not have to worry about Wi-Fi. So as you can see, we can take these things and we're very nimble. And that's why you want Android, because we can build things very custom. Yes, you can take an iPhone and put all these weird cases on it, but you're still paying $1,000. We can build you something much less of a cost that has a longer life cycle and is tailored specifically to the exact use case that you need. That's why we use Android, and that's really the crux of why we do that.
I really appreciate how you simplified it. I understood it, and I didn't have a grasp on it 30 minutes ago, so I appreciate that. I kind of have a curveball question, and I usually take advantage. Victoria and I take advantage of these interviews to ask questions that we're interested in. I don't know if the audience is. I'm interested in how much of a difference there is for you as the CTO as you go from vertical to vertical. Can you give me an example? If you're working on something in long-term care or acute care, tell me, is it drastically different when you're doing something for defense, or completely different when you're doing something for retail? Are there any similarities that might also surprise us?
There are similarities. Obviously, the key here is Android, right? It's the same operating system. And because it's Google certified, we have to meet the same requirements, no matter what the end device is or what the actual piece of gear is. But yes, that's the similarities. The differences are the form factor and the actual use case that you're using it in. So we have won some SBIR awards, which stands for Small Business Innovative Research Grants, by the United States Air Force. So we're actually building some gear specifically for pilots that make sense and are built to fit the needs and the uses, for these pilots. Things like maybe monitoring their vitals while they're in the cockpit. There's a lot of use cases here that we can actually build. So in the federal government, one of the benefits is, by default of being Google certified, by having a GMS license, we meet a high percentage of the requirements to actually be deployed in the government. One of those is, and I don't want to go too technical, but we use the same encryption that Google basically requires us to use. And by default, those encryption modules are already certified for government use cases. So the checkbox there means in say the healthcare vertical is that any PII data that's transmitted or stored on the device is secure. Any sort of healthcare or HIPAA requirements by default of transmission and storage is secure to a defense grade capability. That's just built into the requirements. So that's another similarity. We also do a lot of logistics and food delivery type use cases, because look, you're not gonna go buy an $800 Samsung or $1,000 iPhone and give it to a driver to drive back and forth. So we build low cost devices that meet the need, and so that's kind of like some of the verticals that we're in, finance as well. But yeah, the similarities are going to be the operating system, the management capabilities, and the security. And the differences will be whatever we need to tailor for that particular use case in that vertical. Does that make sense?
Yeah, it does. I want to have a follow-up question and understand how you go about solving a problem. So if you can think of an example, in the last year or two where you've been brought a new project by a client of yours, or a project that you all developed in order to go out and find clients. How does it come about? What is the first conversation look like when you decide that you're going to either take the bid or take the project or build it out? What do you do as a CTO? Do you build it out on a roadmap? Do you find, if you have the team, do you see what the competition is? And if you have an example without either saying the name, try to walk me through the steps. I'm interested from the engineer, the high level managerial point of view of how you develop this.
Yeah, so that's a great question. So that part of the business is actually run by, we have other folks, obviously, that manage that process. I know the process intimately, but it comes to us in several ways. One, word of mouth, because we have a good track record. We have other customers that, they have friends and colleagues that are in different groups. But one of the biggest ways we get opportunities is through the carriers, right? For mainly the U.S. carriers, T-Mobile, AT&T, Verizon. So we get leads from them. And when I say leads, they have solutioning teams where, a typical Android consumer first device, that's what we use the term as consumer first. Any of the phones you'll find on the, carrier website, those are consumer first. And so people try and put those into environments where they make use of those. What I would say is that we have an enterprise first focus. So we'll take those devices and build them specifically for customers. So we'll get a solutioning request, and we'll sit with the customer and the downstream partner all the way from paper design, all the way through the use case. And at the end of the day, that customer owns the device. We don't have our logo on it. It's branded for them. It has the logos for that company. So it's all the way from paper, all the way through design, software development to production. We actually, if they want a special case, if they want to have the circuit board in a specific size tablet, we actually facilitate the molding. So we build it from top to bottom, and then we assemble it, and we deliver it out of our offices in China. We also have facilities in Taiwan, and we actually are we ship out of Hong Kong, but all the development and design is done here in the U.S. The other way is through Google, because we are one of about 100 or so GMS licensed device makers. So, you've heard of the Samsung, the Nokias, the Motorola's. We are also a GMS license holder. But the difference is we have something called an EDLA. That's Echo Delta. Sorry, it's been so long for the Lima Alpha. So it's EDLA. It stands for Enterprise Device License Agreement. That gives us the leeway and sort of like a longitude to kind of like build specific devices that meet specific needs, but still fall under the guise of having Google supported devices. So by that, private label means we can do a lot of different things. And again, we work with customers that are sent directly to us by the Google solutions team. And we will work with that partner and that customer, and typically anywhere from 9 months to a year, from, like I said, writing it out on a piece of paper, drawing it, all the way through what we call DVTs and EVTs. These are terminologies and technology for where we have mock-ups of actual devices, then we have the working devices, and then we have beta versions. The whole process we go through. And at the end of the day, our downstream customers and partners, they own the device. We're just their manufacturer. Does that make sense?
It does. I want to ask you a question about the challenges. I want to ask you, I guess specific around healthcare, since we're in healthcare. Victoria and I are newish to healthcare, two years. There have to be some things that are really, really hard. I feel sometimes like we're dinosaurs in terms of catching up with things. We have a lot of processes, we have a lot of people, we have a lot of HIPAA compliance, and innovation can be slow. What are some that you could point to that make it hard for you all to take healthcare to the next level?
Well, like you said, it's always innovating. There's a lag, not quite as bad as some other markets, like like the federal government. They're typically, we call N-1. So that's like released now, 1-2 years ago. That's the technology they're in. I don't see healthcare in that, sort of in that realm. I see them adopting newer technology much, much faster. Like if you walk into a lot of modern facilities, you'll see it used to be, old TVs up on the wall, and you had this corded thing, and you push this big button for a nurse. I'm seeing a lot of new capabilities that are making more sense, that are more streamlined, more cost effective. A lot of the monitors that are on the walls. From our perspective, it's just looking at that from a holistic point of view, working with a lot of healthcare vendors that service and support the healthcare industry, and where we can supply in our sort of swim lane for mobility and solutions of that nature. We sort of watch that market and try to integrate and iterate what we build based on what we see, the vertical needing, like the vaccine care. We also we build a wearable for Predict Care, which is, it's actually a wearable that, we'll talk about this at some point, but it's a wearable that in a healthcare facility, long-term healthcare facility, this thing can actually alert the nursing station if the analytics know that normally this person gets out of bed at 8 a.m. And because there's a gyroscope in there, we know that the person hasn't stood up, and it's like 9:30. The analytics here can notify the nurses. So you can see there's a lot of great use cases here. And that's just a couple. I mean, we could go on and on about that, but I think that's one of the things that we look for.
In terms of things that you're proud of, tell me about social mobile, something that's a first, or something that you're most popular for, or something that everyone asks for, or people recognize you for.
Yeah. So we already touched on one topic, and that's that enterprise device license agreement. We were actually the company that Google built that license agreement for. So we were the first. The last time I checked, I think we're still the only one. And it's very key to understand that it's private label. So we're not taking like a Samsung tablet, putting a case around it, and building a stand. We actually build the actual piece of hardware. And then we have the software that layers on top of that, as well as the management capabilities. Those are all enterprise and Android certified. So it's a slight different concept. It's private label. We're super proud that we're like one of the first for there. The other is that coupled with that, we are also an ISO 27001 certified company, and that's top to bottom. So that assures all customers and partners that we take care of their personal data, and we have this framework of making sure that we protect that information. So that's key. We're one of the first to have that in our field. I think the other is just the innovative side of the business. We can actually build an Android device within 9 months to a year from start to finish. That's was never even thought of before, based on a design. So I think those are the three big things I would say I would be most proud of about what the company has done.
How big is your team to be able to build something that fast?
Yeah, so there's a production and design phase. Obviously, there's a sales phase before that. We have some project managers that will manage that entire process based on the product. We have a team of product managers that will work with that. Then we have a production and engineering team, which is based in. We have several locations. So some are based in London. That's where our product team is. We have some engineers there. We have some of the design people and the project managers are based out of our headquarters in Hollywood, Florida, not Hollywood, California. Sorry, guys. And then we have boots on the ground production and operation people in Shenzhen, China. So this is where our factory is, and so we have real employees there that manage that process. So it's sort of a all hands on deck. I don't mean it that way, but like everybody's working together and led by a project manager to get this product done. We have a very streamlined process. We've been doing it for 10 years. So we've got our processes and our partners and the inventory of the computer chips. We're not sort of prone to the shortage of microprocessors because we have our own inventory of them. And so we can deliver products very quickly. So that's why we can squinch that down to 9 months to a year for something that's never been built before.
Mm. In terms of what is on the horizon, what are you going to roll out in the remaining part of 2022, and what are you excited about for 2023?
Yeah, we have some new products. I'm not really at liberty to say exactly what they are, but some of them are iterations on our current off-the-shelf devices. We have some very unique use cases that we're actually in production with, which will be in the sort of some of the other verticals that are sort of associated with healthcare. I don't want to lead into too much, but there's a lot of different use cases that we're starting to build devices for. And then obviously the federal government. We've started to get some traction there. And then our partnerships with Android and Google are growing, as well as with the carriers. And we now actually, one of the biggest things that we're doing this year, and we've already delivered, is that our devices are certified on the carriers. It's not like it's an unlocked device and you can put a T-Mobile or an AT&T SIM in and it just works. We've actually gone through a certification process. AT&T, T-Mobile, Verizon, they have our gear in their quote unquote network labs, and they've put our devices through the ringer. So we actually are certified on their networks. We're going to keep rolling out that plan this year. So look for some new products to come out the door, towards the end of this year.
Mike, as we start to wrap up, I know as a first-time visitor to HIMSS, you and I met in February, I believe, in Orlando at the HIMSS convention, and I walked away just, blown away by all the things that were happening in healthcare from a technology point of view. A lot of it was new to me. A lot of it was over my head. What observations or what reflections did you take away from it and take back to Social Mobile to pivot, to adjust, to 10X, to double down?
Yeah, super great question. I think a couple of things that I saw that were pretty impressive was, and as you probably noticed this, there's a lot of new technology out there, and it's designed to make patient care easier, but also for patients that are in long-term care or long-term facilities, making their life easier. And so things like these wearables that are non-intrusive, that sort of gives real good care. We have a particular device called we made it for OneView. So like in some of the hospitals in Australia and in New York City, we have a 22-inch tablet that's on an arm that comes over. And some of the software that's being integrated makes it super easy because the patient can open up their part of like, say, the healthcare application. They can see their prescriptions. They can watch Netflix. They can have, they can do like video conferencing with their their family members. Instead of the old school model, this is making it feel more like home for patients, right? So I thought that was really really neat thing I saw there. With a lot of integration. I think connectivity, you're not bound to being in a hospital or something, like a Wi-Fi connection. I'm seeing a lot of carrier integration with 5G. The prices are being driven down. And so being connected, monitoring vitals remotely, a lot of stuff is super important to get care done quickly, to monitor, analytics or vitals from a patient. And having, I'd say, I wouldn't call it artificial intelligence, but there's sort of some things that, the doctors can rely on these new technologies to help them diagnose and do it much faster. So I think the quality of life and the ease of getting healthcare was what I took away from him. I saw a lot of new technology, very innovative stuff. I was quite surprised at the size and the number of vendors that were there. So it was pretty impressive.
I was as well. It was one of the largest trade shows I'd ever been to. Mike, thank you so much for joining us on LTC Heroes. What I really appreciate is your insight from a technology point of view. Victoria and I spent a lot of time talking to humans who take care of humans, but to talk to someone who's helping us take care of humans better, more efficiently, faster, safer. It's great to have you on the program. Thank you so much.
Oh, you're welcome. You're absolutely welcome, Peter and Victoria. Thank you for having me on. It was a very nice discussion. I appreciate it.
And hopefully see you at HIMSS in about 9 months.
You bet. I can't wait. Look me up when we get there.